High above us, amidst the clouds and the sun, a threat persists. It's not a predator in the traditional sense, but a virus bird flu. This virus, while often associated with birds, casts a long shadow, one that can reach us humans and impact our lives in significant ways. Understanding bird flu is not just about protecting avian populations, but also about safeguarding our own health and well-being. Bird flu, also known as avian influenza, is a type of influenza virus that primarily infects birds. While it might seem distant at first, the virus's potential to mutate and jump to humans makes it a global health concern. The consequences of such a jump can be severe, leading to widespread illness and even death. Therefore, unraveling the mysteries of bird flu is crucial for building a safer world for both birds and humans. Throughout history, we've seen the devastating effects of viral outbreaks. Bird flu stands as a stark reminder of the interconnectedness of all species and the importance of vigilance. By understanding the virus, its transmission, and the measures we can take to prevent its spread, we can mitigate its impact and protect ourselves and future generations. Like soldiers in an invading army, bird flu viruses come in different forms, each with its own characteristics and potential for harm. These viruses are categorized into different types based on their genetic makeup and the severity of the illness they cause in poultry. Understanding these viral subtypes is crucial for developing effective vaccines and control measures. Among the many subtypes of bird flu viruses, two have caused the most concern among scientists and health officials: H5N1 and H7N9. These highly pathogenic avian influenza, HPAI viruses, are known for their ability to cause severe illness and death in birds, often with mortality rates approaching 100% in infected flocks. The H and N in their names refer to specific proteins on the virus's surface that play a crucial role in its ability to infect cells. While bird flu viruses primarily infect birds, certain subtypes, particularly H5N1 and H7N9, have demonstrated the ability to infect humans. These human infections are often associated with close contact with infected birds or contaminated environments. While human-to-human transmission of bird flu is currently limited, the possibility of the virus mutating and gaining the ability to spread efficiently between people remains a serious concern. Imagine a world without borders, where organisms, even microscopic ones, can traverse continents with ease. This is the reality of bird flu, a virus that knows no geographical boundaries. Carried by the very creatures that grace our skies, bird flu spreads through the migration of wild birds, crossing borders and oceans, silently carrying the virus to new and unsuspecting populations. Wild birds, particularly waterfowl like ducks and geese, act as natural reservoirs for bird flu viruses. These birds can carry the virus without showing any symptoms, shedding it in their droppings and nasal secretions. When these infected droppings or secretions contaminate water or soil, the virus can spread to other birds, including domestic poultry. Live poultry markets, where birds are often kept in crowded and unsanitary conditions, have been identified as major hubs for bird flu transmission. While direct contact with infected birds remains the primary route of transmission, humans can also contract bird flu through indirect contact with contaminated surfaces or materials. For instance, touching contaminated cages, equipment, or even shoes worn in infected poultry farms can expose individuals to the virus. It's important to note that properly cooked poultry and eggs do not pose a risk of bird flu transmission. In the world of poultry farming, recognizing the signs of bird flu early can mean the difference between a contained outbreak and a devastating epidemic. Just like humans exhibit specific symptoms when fighting off an infection, birds too display telltale signs when infected with the bird flu virus. Being able to identify these symptoms is crucial for timely intervention and containment. Infected birds may exhibit a range of symptoms, from mild respiratory distress to sudden death. Common signs include a drop in egg production, quietness and inactivity, swollen heads, and purple discoloration of wattles and combs. Farmers and poultry workers need to be vigilant and report any unusual bird deaths or signs of illness to the relevant authorities immediately. In humans, bird flu infection can manifest in a variety of ways, ranging from mild flu-like symptoms to severe respiratory illness. Fever, cough, sore throat, muscle aches, and shortness of breath are some of the common symptoms. In severe cases, bird flu can lead to pneumonia, acute respiratory distress syndrome, ARDS, and even multi-organ failure. Section 5. Building our defenses, preventing bird flu transmission. In the face of a microscopic enemy like bird flu, knowledge and proactive measures are our strongest weapons. Just like we build fortresses to protect ourselves from invaders, we can fortify our defenses against bird flu through a combination of individual actions and public health interventions. By understanding the routes of transmission and implementing effective preventive measures, we can break the chain of infection and safeguard both human and animal health. One of the most effective ways to prevent bird flu is to practice good hygiene. Regular hand washing with soap and water, especially after handling poultry or visiting live poultry markets, is crucial in reducing the risk of infection. Avoiding contact with sick or dead birds, as well as their droppings and secretions, is another important preventive measure. For poultry farmers and workers, biosecurity measures are paramount. This includes restricting access to poultry farms, maintaining strict hygiene protocols, and implementing quarantine procedures for new birds. Vaccination of poultry against bird flu is another effective strategy to protect birds from infection and reduce the risk of the virus spreading to humans. Section 6. A Global Watch, Tracking and Responding to Outbreaks. In our interconnected world, an outbreak anywhere is a threat everywhere. That's why global surveillance and rapid response are crucial in our fight against bird flu. Just like a network of sentinels guarding a kingdom, international organizations and national health authorities constantly monitor the spread of bird flu, sharing information and coordinating efforts to contain outbreaks. The World Health Organization, in collaboration with other international organizations, plays a pivotal role in global bird flu surveillance. Through its Global Influenza Surveillance and Response System, the WHO tracks the evolution of influenza viruses, including bird flu viruses, and provides timely information to countries to guide their response efforts. This global network of laboratories and experts acts as an early warning system, enabling a coordinated and effective response to outbreaks. When an outbreak is detected, rapid response is crucial to contain the spread of the virus. This typically involves culling infected or exposed birds, implementing quarantine measures, and disinfecting affected farms or areas. Public health education campaigns are also launched to raise awareness about the virus, its symptoms, and preventive measures. While bird flu currently poses a limited threat to humans, the virus's ability to mutate and adapt raises concerns about its pandemic potential. A pandemic occurs when a new influenza virus emerges to which humans have little or no immunity, resulting in widespread illness and death. The 1918 influenza pandemic, caused by a novel influenza A virus, serves as a stark reminder of the devastating consequences a pandemic can have. The constant mutation of bird flu viruses, coupled with their ability to reassort their genes with other influenza viruses, increases the risk of a pandemic strain emerging. Reassortment occurs when two different influenza viruses infect the same cell and exchange genetic material, creating a new virus with a mix of genes from both parents. This process can lead to the emergence of novel influenza viruses with pandemic potential. Preventing a bird flu pandemic is a shared responsibility, requiring collaboration between governments, international organizations, scientists, and the public. Strengthening global surveillance systems, developing effective vaccines and antiviral drugs, and promoting public health measures are crucial steps in mitigating the risk of a pandemic. In the battle against infectious diseases, knowledge is power. The more we understand about bird flu, the better equipped we are to protect ourselves, our families, and our communities. Staying informed about the latest developments, scientific findings, and public health recommendations empowers us to make informed decisions and take appropriate actions to minimize our risk. Reputable sources of information, such as the World Health Organization, the Centers for Disease Control and Prevention, and national health authorities, provide accurate and up-to-date information on bird flu. These organizations play a crucial role in disseminating evidence-based information to the public, dispelling myths, and promoting effective preventive measures. Social media, while a powerful tool for communication, can also be a source of misinformation. It's essential to be discerning about the information we consume online and rely on trusted sources for accurate and reliable information. By staying informed and sharing credible information with others, we can contribute to a safer and healthier world. In the face of a global health threat like bird flu, it's easy to feel overwhelmed or powerless. However, each of us has a role to play in preventing the spread of this virus. By taking simple yet effective precautions in our daily lives, we can collectively make a difference. Practicing good hygiene is paramount. Wash your hands frequently with soap and water, especially after handling raw poultry, visiting live poultry markets, or coming into contact with birds. Avoid touching your eyes, nose, and mouth with unwashed hands, as these are entry points for the virus. If you experience flu-like symptoms, especially if you have recently traveled to an area with reported bird flu cases or have had contact with birds, seek medical attention immediately. Early diagnosis and treatment are crucial in managing bird flu infection. A bird flu, with its potential to impact both human and animal health, stands as a reminder of our interconnectedness and the importance of global cooperation. It is a challenge that transcends borders, requiring a collective response from governments, international organizations, scientists, and individuals alike. By working together, sharing information, and implementing effective preventive measures, we can mitigate the threat of bird flu and protect our world from future outbreaks. Just as birds soar through the sky, connecting different parts of our planet, let us bridge the gaps between nations and work together to create a healthier and safer future for all.